Good morning.
Well, good morning. Nice to see you. As always, favorite days, Tuesdays and Thursdays. Great, great questions, great answers. Now, if I can only speak. Here we go. Can we get started?
Sure.
All right. Okay, so as always, we have the great questions. Number one comes in as Dr. Rosensweet. I had to switch to injection estrogen as I am not absorbing any estrogen via my skin. And I'm wondering your thoughts on this, please. And it's a two-part question, but I'm going to stop right there because I got like four other questions of the same thing just this morning.
Sure.
Thank you. And I'm hoping you're well.
Well, and we get so you have to mute. Um, I'm I can't see any reason in the world why you would need to switch to injections. I'm going to raise the possibility that you just haven't found the proper base that the hormones are carried in, or the proper dosages. And it amazes me from time to time as I consult with providers all over the country, some of the dosages that are being administered, they're minuscule compared to what a woman needs. And I'm not going to go into the reasons why I think that's occurred, but prior to anything else, I think this questionnaire should go shopping to see, or have her provider contact me directly. I'm very open to consulting with individual physicians, nurse practitioners, PAs that are prescribing, advising compounding pharmacists or prescribing compounding pharmacists, because I say this is solvable by topicals. And I mean, who in the heck wants to inject estrogen every day or anything every day? Or if you start breaking it up into one or two or three or four times a week, you're getting into a weird thing because you inject, your levels go way up, and then they gradually taper off. Well, if you're doing that every 2 days or every 3 days, that's so different than physiologic. And I have a case in point. I recently consulted with a woman who was injecting estrogen, and she got such high levels. She got a thickened endometrial stripe, and then she menstruated, and she was in her late 60s. And it's because it's so hard to manage the dosages. I never say never to anything, and hormones, if they're bioidentical, and no matter how you get them, or even if they're not bioidentical, getting the hormones is so much better than not. So I'm not trying to discourage you from whatever method ultimately works for you, but I am going to challenge that there's something needs to be tuned up about the topicals, because I've never, in 27 years of specializing in this with women, run into a case where we just didn't figure out the right dosage, right combination, right base. I recommend, of course, I'm a strong proponent of our organic oils base. And geez, it always works, unless for those extremely rare cases where there's a local skin rash, and then we have to switch the base. But it always works, and it's just a matter of getting the dosage and the percentages and bias right. And so it's back to the primary job, I think, of all women, is to keep going shopping. Who likes to do that? You wish you could just dial right into the perfect practitioner that lived in the little strip mall that worked out of the local strip mall that's a walk from your house, and you get to go in there and get great treatment. But we're not there yet. But gee whiz,
That's
menopause.
major concierge service right there. You could just bring them right into your own home.
Yeah. But we live in an era where all menopause medicine, providing you have a primary care provider, a gynecologist that's handling any menopause needs that need to be met in person, or any medical needs that need to be met in person, all the menopause work, all the hormonal work can be done by telemedicine. So that means all you need to do is find someone who's really good at this. That is, this meaning treating women in menopause with compounded bioidentical hormones in the state in which you live. And you can go to menopausemethod.com. We've trained providers all over the country, and sometimes we can assist you to find someone that we've trained, or there's other ways to find people who are trained. You can go to A4M, the letter A, the numeral 4, the letter M, and type in your zip code to find a provider, or ACAM, or AMMG, or IFM. All these are functional medicine type organizations that have various forms of training. You can find somebody, go out and find somebody. And if they really want my support, I'm happy to consult directly with them. I can't consult directly with you, but I can consult with your provider.
Well, thank you very
We're
much.
talking about long-term solutions. We're talking 10, 20, 30, 40 years. If you can get it right within a year or two, it's fantastic. And then you're just on cruise-o-matic pretty much for the rest of your life. At most, you get some dosage tweaking and some periodic testing.
Cruise-o-matic. I am on cruise-o-matic right now. I like that word, and I'm going to use it. It took me a good 5 months to about a year. Okay. Moving on to our next question, because I can bring this around. Because I think this is really important. And I also got a bunch of questions this morning just about this one, too. Oh, Dr. Rosensweet, I need help with my horrible insomnia. I've been dealing with it since 2008, and I've been on hormones since 2008. I'm taking estrogen, progesterone, and testosterone. My doctor says that 300 milligrams of progesterone is a high enough dose and certainly should be helping me sleep, but it is not working. Nor is melatonin, nor is anything else, and I just can't sleep. It's horrific. And I'm wondering if you please have any good words about how any of us who are really suffering from this sleep deprivation might get some relief.
I love this question because it's such a common challenge. And then you have a woman just like this questioner who's reached out and tried hormones, and you wind up getting discouraged because you can't seem to figure out the recipe. And there's very few sleep challenges that we don't ultimately solve. And there's some women that, boy, we can get them in the ballpark and they get to sleep well most of the time, or a lot of the time, but not all the time. Any woman who solves it once, like if you can put together the recipe of all that it takes to sleep well once, that's living proof that your body knows how to put together the biologic recipe. And why I'm mentioning this is because we're dealing with this with one of our patients right now. She didn't sleep for years and years and years. We figured out the recipe. She slept really well for a period of time, and then she's back to not sleeping. So I like to mention this, although this isn't a direct answer, that if you can figure out that recipe once, it's living scientific proof that your body can figure it out biologically. Sleep, many moving parts. One of the most common ways to address this in a woman who's midlife, if she used to sleep well when she was in her 20s and 30s and teenagers, then her body knows how to put together the biology of sleeping, And the elephant in the room is what the heck happened at midlife that you're no longer sleeping like your 20s and 30s? Well, it's pretty obvious that your ovaries stopped. So we want to address those ovarian hormones. And sometimes it's not hard. Sometimes it's pretty simple and pretty direct. You get the estrogen right, you get the progesterone right, you sleep. It's a miracle when that happens. And the key word there is right. You get it right. So even though you've been on hormones, one of the things that we would do in the menopause method is we'd start from scratch. And how we do that is we give you an extensive questionnaire to fill out during your first consultation. Your provider walks through line item by line item, and we learn a heck of a lot about you. And then we start from scratch. Because I'm not challenging the work that was done on you, but it's possible that there was something off in your recipe. And we look at, as far as hormones go, there's other moving parts in sleep disturbance. Oh, yeah. But as far as hormones go, and again, they're one of the most common things in a midlife woman who used to sleep well, is there's the estrogen component and there's the progesterone component. And they are different. And estrogen and progesterone are in a certain balance. So although 300 milligrams is a more robust dose than the women in my practice usually oscillate into, the progesterone dose in my practice, women vary tremendously. We're all individuals. We all have our individual sensitivities and absorption abilities and the effects of whatever we're doing. And women are oscillating in from anywhere from 50 milligrams to 175 milligrams. That's the most common range. Sometimes it's topical. A lot of times when there's sleep issue, we use oral, just like this patient is using, because 300 milligrams is an oral dose. And we have women who are on 300. That'd be more on the high end of things. I call this an outlier and unusual, but unusual is usual in the world of medicine. There's no such thing as unusual because we're so individual. So I'm not going to immediately declare that 300 milligrams of progesterone is the correct answer, because hormones, for example, interact with one another. And we're not just going to take into consideration the progesterone dose, we're going to take into consideration on the effect on whatever estrogen she's taking. For example, estrogen deficiency relates to a lot of things, big time. You lose your estrogen, you got to replenish that estrogen or you're not going to like it. And you're not going to like it for 10, 20, 30, 40 years, and it keeps getting worse. So you want to replenish estrogen, fine. And the way hormones work, you've got the hormone, let's say this is estrogen, and interacts with the receptor site within the cells. And that interaction is what causes the effect. Well, estrogen is what binds best, which interacts best with estrogen receptor sites. Makes sense. It's the best for estrogen receptor sites, but it's not the only thing that can bind to estrogen receptor sites. For example, progesterone can bind to estrogen receptor sites. Not as vigorously or effectively or strongly as estrogen is going to be able to bind estrogen receptor sites, but it will do it. And if you get into more robust dosages than your body needs of progesterone, there's this chemical law called the law of mass action. That if you got too much of something, even though it doesn't bind as strongly to the mere sheer over excessive quantity, is going to be capable of overriding the binding coefficient, and that progesterone is going to occupy those estrogen receptor sites and knock estrogen out of it. I'm not saying this is what's happening to you, but when I hear the number 300, it immediately makes me go, yeah, is that too much? Now, I can understand why your provider would want to keep on increasing that dose because under many circumstances that can work. But in other circumstances, that can be too much, and so you're not getting the proper balance. That's why I say we start from scratch, and we start low, and there's different kind of symptoms are prevalent as they relate to sleep with estrogen and progesterone. Progesterone is the great calmer. So we always take progesterone at bedtime. And like I've said many times, if we were to inject a proper dose intravenously of progesterone into myself or you, Carolyn, or anyone, we got the dose right, we could be put to sleep so deep surgery could be performed on us. That's not a very unusual hormone. Most hormones that you can name, with the only other exceptions, melatonin, are activating. They're actively recruited and participate vigorously in the fight or flight biochemistry. All of them. Thyroid, adrenaline, cortisol, estrogen, progesterone. I'm sorry, not progesterone. Estrogen, testosterone. These are all recruited for fight or flight. Not progesterone, that's the great calmer. So, women who have trouble falling asleep, or some women who have trouble staying asleep, they're not getting enough progesterone. Or they're not getting the right amount of progesterone. But we don't want to give you too much progesterone, so we start low and we gradually increase. And when I'm trying to find out or assist a woman to find out the optimal dose of progesterone, and we switch from topical to oral, as we commonly do, especially when there is sleep issues, we prescribe 30 capsules of 50 milligrams of progesterone and 30 capsules of 25 milligrams of progesterone. And we have the woman start at 50 milligrams at sleep time. And if that doesn't help her sleep, within 3 nights, we do it usually 3 nights in a row. Every 3 nights, we change by adding an additional 25 milligrams. So the second 3 nights, she's taking 75 milligrams. The third 3 nights, she's taking 100 milligrams. Keep on increasing. And we like to keep a woman who's having sleep problems, or a woman who we're trying to support her with her bones or her mood, we like her to keep on jacking up her nighttime, bedtime progesterone dose until she wakes up in the morning groggy, which means it's like she feels like she's had an overdose of a sleeping pill, which means she's on an overdose of progesterone. So we immediately, the next night, we switch to 25 milligrams less. And so let's say that her magic number was 175 milligrams. That helped her sleep. 200 milligrams was too much. She woke up groggy. We would then write out a single prescription for progesterone capsules that contain 175 milligrams. And that'd be her progesterone part of sleeping. There's an estrogen deficiency sleep disturbance. For example, a woman who wakes up at 2 o'clock in the morning and her mind is totally active and she's got a racing mind and she's thinking, and she can't fall asleep for a while, that's usually an estrogen phenomenon. And what's actually going on there is in the middle of the night, her body is reading that she does not have enough estrogen. That's stressful. She usually has a hot flash, but she may or may not feel that. The part of the hot flash, which is the inconvenient truth, is the squirting out of adrenaline because it's stressful. So she triggers the biology of the stress response. So she gets a nice squirt of adrenaline into her bloodstream. And unlike when she's 20, when her liver is so vigorous and healthy, she gets to stay awake for the length of time it takes for her liver to metabolically process and thus eliminate the extra adrenaline that got squirted in there. Pretty rapid when you're 20, not so much in a 50-year liver. And we always assess this in our initial evaluation. We ask a woman the question, can you drink a cup of coffee with dinner? Would you drink a cup of coffee at 9 o'clock at night? A 20-year-old will say, sure, no problem. I can drink 2 cups of coffee with dinner and I sleep like a baby. I never even thought of it. Yeah, but you ask how many 50-year-old men and women, men and women, can drink a cup of coffee at 9 o'clock at night or with dinner even. They're not going to be able to sleep because their midlife liver is going to take quite a bit longer to process and metabolize and biochemically transform that caffeine. Well, that's what happens in the middle of the night with a woman who's giving an internal dose of adrenaline. So that middle of the night, waking up several times a night, racing mind, that's an estrogen deficiency. So how we handle that is we always recommend that a woman take her estrogen, that she take biased topically. We recommend the organic oils mixture, but there's you can get biased. You apply it to your skin, and you apply it twice daily. And your nighttime dose, sometimes we make it a little higher than your daytime dose. And we gradually, slowly, we start low and gradually increase until, lo and behold, your daytime hot flashes disappear. And more than that, your nighttime hot flashes disappear. So between estrogen and progesterone, we have a lot of tools there. I love melatonin. I take melatonin myself. It not only is important for sleep, it's a premier antioxidant for the nervous system, for the central nervous system, for the brain. We love our brains. Don't you think, Carolyn? Oh, you're nodding your head now.
I'm muted, but yeah, my brain, I want to shut it off sometimes. I don't know if I can answer that honestly. But yes, our brains are important.
You do like your brain.
I do.
Yeah, admit it. So there's other things that relate to sleep. If you don't have your estrogen and progesterone in balance in your perimenopausal, you're going to get an increase in testosterone. That's animating. That's not as common as it used to be, but it happens. Then there's this thing that I've heard about, never had it myself, but I have heard about it. I read it in a medical text. There's this thing called stress. Have you ever heard of it, Carolyn?
Yesterday it was brought up, and I had to study it a little bit. Stress, yes, I have heard of it, and I've experienced it.
I've only heard of it. I've never experienced it.
I don't believe you.
Okay, maybe I'm not remembering correctly. And it's not the stress. Life has the many different important, healthy, crucial processes, and stress is one of them. It's natural to human life on Earth. Stress. And it puts us in a university called, can I acquire some information and tools to deal properly with stress? Or am I going to go ballistic in my mind and my emotions every time some little blip comes along or some major blip comes along? Because some of those blips, as everyone knows, not me, this is theory to me, but sometimes there's major blips that come along. I mean major, and anyone who's had a major blip knows exactly what I'm talking about, which happens to be everybody, because we're human beings. It's built into human life. And so if you're not managing your stress elegantly, successfully during the day, guess what goes bump in the night? It's a perfect time. You're laying down, you're tired from having gone through many different activities during the day. You sort of lose control there as you drift off into partial sleep or sleep. You no longer can keep a lid on repressing the feelings that you didn't deal with successfully during the day. So things go bang in the night. And I've saved the best for last. That one. And if you're not sleeping and better living through biochemistry, i.e. hormone adjustment, and adding melatonin isn't doing it for you, you may have to take on this project that I definitely was inspired to take on in my life in my late 30s. What are my emotions about? How am I responding to my life? Am I reacting? Am I upset about things in my life? Well, this was the thing that called for the most commitment of time, energy, financial resources, courage that I've had in my lifetime, acquiring the information, tools, and support to learn about and succeed with my own emotions and my own mind and my own life. This is what we're here on earth to do. Grow, increase our wisdom, increase our functionality. And the rewards are enormous. The rewards are coming home to the truth of who we are and thus experiencing happiness, joy, pleasure, love, connection, miracle, relationship. We get to show up and be present for the miracle that day-to-day life actually is. But here's was a revelation to me in my late 30s. There was so much I didn't know, and you don't know what you don't know. But life brings everyone to our knees. If we're not dealing well with relationships, with communication, with self-healing, with developing personal responsibility, that means anything that goes on in my being, any emotion that goes on, these are me, this is mine. I've got to have skills to deal with that, not blame it on the communists or my next door neighbor or my spouse. Well, things go bang in the night, and there's even a biology to that. I mean, a lot of folks, they're awake at night because their fight or flight chemistry is still raging. Get high cortisol at night. There's some supplements that are purported to assist with this cortisol output at night, which is opposite to what is normal and healthy physiologically. But I don't know. You never get to override something that is deeper and more meaningful to your heart and your soul and your life. So good luck with the supplements. Phosphatidylserine, to name it. Good luck. No, get to the heart of the matter and admit it. You got some discovery of process to do around your emotions, your mind, and how you're navigating. And what do you know? Don't these things just sort of really pop out in the open midlife? Because if you haven't sorted it out prior to midlife, you can count on it, because you're moving into a life stage that you're moving out of householding, you're moving out of working and stuff, and you're moving into the time of life that's devoted to your spiritual growth, at least how life is set up. So I know, yes, once again, you asked a simple question and off I went into the wild blue yonder.
But you know, Dr. Rosensweet, it's not such a simple question and it's not such a simple answer. And I think for a lot of us, or at least I'll speak for myself, I thought if I can just get a hormone into my body, I will be better. Oh, was I wrong? And I had done the work, much of it, midlife a few decades ago. I also had a father who was a really brilliant psychoanalyst that taught me a lot of stuff, but boy, I didn't know what I didn't know, and I had to start learning what I didn't know. And it's not easy. And it's very humbling and a little frightening to do this work. So God bless you for bringing it up, and often, because I think that we start to embrace that and really hear it. And I think it's really important. And I appreciate always that you bring that up, because.
And there's a little more, if I may, Carolyn, comment on it. There's the going in and addressing and healing the fear, the sadness, the anger, the shame, the guilt, the emptiness, the loneliness, the meaninglessness, the hopelessness, the powerlessness, these feelings that we all come to Earth with that we usually repress or project or something. There's that part, the healing part. And then if you're waking up at night, if you start asking the question, why am I not sleeping? Because a strong physical symptom like that is part of a very, very natural process. Disrupting your sleep is capable of stopping the world for you. And that's how our beings work. You get a disruptive symptom like that, what its purpose is to catch your attention. And what it wants something of you. What it wants you to do is stop in your tracks and go, what the heck is going on here? The problem is, it wants the real answer. As much as I love melatonin and take it every night, in many cases, it's not a melatonin deficiency that's capable of disrupting waking you up at night. If it's waking you up at night, something's bothering you. And there's the immediate and there's the deep, and it's usually the deep stuff. And so may it inspire you to have the courage and the gumption and the willingness and the commitment to reach out and get help with your emotions and your mind and your life. Because, for example, your being may have got used to living lonely, living unconnected, even for those who are in a marriage or those who are living alone. This is a big deal. There's absence of a natural human desire for love, for connection. So the medicine, you can do all the processing in the world, and God bless all of us who have, and all of you that are about to. However, ultimately, you got to be giving yourself what your being, your heart, your soul really wants and needs. How in the world are you going to sleep if you're not providing something that matters? Well, what matters? Is it your new BMW? Not really. You might have a day or two thrill of going out and purchasing your BMW if you've got the resources to do that. Is it, there's just so many scenarios we can think of, but it is going to be something that really matters to you, and that's the challenge. So it's going to be happiness, love, inner peace, connection with the divine, connection, deepening the connection with the people, your family, your friends, having more fun, feeling your own internal happiness. So ultimately, the remedy is there. The purpose of the process is to heal. That's beautiful. That's majestic. It's a miracle. But the benefit of healing is it gives you access to being present in the moment and experiencing what life is really about, what living truly is about having fun and being happy and experiencing the sacred aspects of life, of which there are so many, and they're so simple, and they're available to all of us. I heard Deepak Chopra being interviewed last night on a YouTube video by Trevor Noah, no less. And Deepak was saying, Trevor was asking, what's the secret to happiness, basically? And he said, it's not the wealth you're going to accumulate. That guarantees you nothing. It's the friends, it's the love, it's the it's the healing, it's coming home to the truth of who you are. So if you're not sleeping, that's a big deal. And we can try and do better living through biochemistry. I love to do it. But you got to get at the stuff that really matters to you. You've got to give yourself in your life the fun, the love, the happiness, the pleasure, the joy. You got to find your way to that. And then you sleep well because, hey, it's good. Life is great. You're living in the miracle of living rather than doing some facsimile. So thanks for the, always being a wide space for me to go into, I think, where the real meaning is and where the real cures are, where the real medicines lie.
It's not often that you can go running into your doctor's office and get some hormones and be told all of this. 8 minutes. And so it's always appreciated. And we will do another interview like we did on the psychology. And that was a great interview.
Go to www.iwonderdoctor.com. I wonder, doctor. I wonder, doctor. iwonderdoctor.com. We have a whole section on anxiety and depression. We called it that because that's the usual doorway symptom-wise to people really learning about their emotions. It's an introduction. There's some tools in there, and there are a million resources for you to get support. There's an army of therapists out there, people who have done the great work themselves. There's seminars, there's online information. It's just beautiful. So the list is long. All you have to do is develop the desire to heal and a desire to find your way back to fun and love and happiness and inner peace. The resources at this time in human history are just so prolific. They're all over the place. And what do you know? Your two neighbors down from you may have done the great work herself, and all you have to do is sit down with them and ask them, how'd you get so happy? How come we're the same age and you seem at peace and I'm agitated? They'll tell you, and they'll connect you to to other resources in your community. People who are taking this on as a profession and can assist you, because just know, if you find me semi-pleasant, it's a lot because of all the love and support and professional support and seminars and sessions and therapy and all the tools I learned how to guide myself. That's really why.
Well, semi-pleasant. I don't find you semi-pleasant. I find you very pleasant.
Wait, yes, I was a good doctor, but I was way too full of, shall we say, piss and vinegar when I was in my 30s and 40s and 50s.
Well, how did you put it, young, arrogant guy that I was?
Yes, right. Unconscious, unknowledgeable, so many things I didn't know that but because I wanted to know it, I was presented with the teachers, the mentors, the knowledge bases, and the practices, because it's the practice where the heavy lifting takes place, the day-to-day practice.
Right, and oddly enough, they show up. They do. It's a weird thing, but I can't explain that one. But we'll get into that one day. I want to ask you, Dr. Rosensweet. In our last interview, you and I spoke, as we always do, about progesterone, and our questioner is asking if you know, and we did justice it, but it's a different question. The minimal dose of progesterone needed to achieve the benefits of progesterone that we speak of so often. You've made mention of, a few different names of women who are amazing, well-known, who will say that we need higher doses. We do. And yet these women are absolutely terrified of taking higher doses because they have bad experiences with even low doses. So do we need high doses, or can we use low doses? It's very confusing. Again, as well-respected people in the field advocate for higher doses of progesterone, but some of us just can't tolerate this. Does this get better if we truly do raise our progesterone dose? These women are terrified.
Fabulous question once again. It always amazes me, the quality of questions that we receive here. And I'm going to deal with the biology first. The progesterone, I find rather unusual amongst all the hormones. Like, I don't know that I've run into a woman who doesn't do really excellent on biased. It's always a matter of finding the optimal dose for that individual woman, but I can't think of an exception of 27 years of specializing in treating women where biased was an issue. It's just getting the proper dosages. Same with testosterone, that critical female hormone called testosterone that's as important as anything you'll ever receive in menopause. I can't think of a woman that we weren't able to sort out the dose. Same is true as thyroid, for example. Not true of progesterone. There are some women, they're not common, but they definitely exist, who have small, medium, or large challenges with progesterone. So the dose range that I mentioned earlier that's most common for the women in my practice, let's just switch to oral, or we could talk about topical, but it's anywhere from 50 milligrams to 175 milligrams, anywhere in there. That's a nice dose. And some could make a case for really maximizing progesterone. I make a case for that. You don't want to go too high that you're knocking estrogen out of its receptor sites by the law of mass action that I was talking about earlier. But you want to maximize it, especially a woman who's lost bone loss, has had bone loss, because progesterone is the only biochemical I know that stimulates the cells that lay down new bone to do that, to lay down new bone, the osteoblasts. So we often try and maximize progesterone. In fact, we'll go over the top and then back down so the woman doesn't have symptoms of overdose. However, there's a significant number of women, they're not common, but they definitely exist, that they can't even tolerate the smallest dosages. Like we start out all women with a progesterone in organic oils to be applied topically that's 200 milligrams per milliliter. It happens to be 8.7 milligrams per drop. We can't get more concentrated than that because that thing is so thick, that particular suspension. And we have one patient on 5 milligrams per milliliter. Very unusual that we drop below 200 milligrams per milliliter topically, but she can tolerate 2 days out of 3, 2 days out of 3, not 3 days in a row, a couple drops of 5 milligrams per milliliter. So part of the art form is really getting creative around the dosage discovery process. And when we can't solve why the woman's having trouble with progesterone, well, here's the good news. There are a zillion redundant systems in the human body. So we're not relying on a single biochemical alone. And when we do generalized biochemical assessments, you'll find holes all over the place. You won't have enough CoQ10, or you won't have enough this or that. So there's so much redundant systems. Again, I'm repeating myself, and there's so many overlaps that when we have ultimate difficulty and we can't solve the progesterone issue, we don't say to the woman, oh, you're doomed, because she's not. There's so many ways to address the internal biochemical issues, and we're talking thousands and thousands of biochemicals in trillions of cells. So there's all different ways to work any given biological issue, and your body knows how to do it. You don't even have to think about it. If you don't have enough of this, you're going to produce a little more of that. Or you're going to get hungry for some food that you go, why am I hungry for this particular food? You won't even know. But guess what? It contains the thing that you don't have enough of, that you need to have a special higher need for. So part of the biggest challenge of life is developing this skill, this superpower called acceptance. And guess what? In some way, everyone tuning into this and every human being on earth is not perfect. You don't have the right amount and the perfect amount of everything biologically that you need. And all your biological functions are not functioning at full steam, right down to the genetics. We're not perfect. And part of the deal is, as that those imperfections show themselves, we have this practice to do called acceptance. Because one of the things we're here on earth to do is called unconditional love. Unconditional love. I don't have progesterone, so I'm not going to love myself forever. And I'm going to lean into there's something wrong with me that if I don't cure it, I'm done for. No, that's not how it is. So we discover who we are and we do the best we can with what we have. And we wind up ultimately accepting. That does not mean rejecting. It does not mean clinging to judging ourselves for the progesterone we don't have or we can't tolerate. Get the picture there? And I'm just talking about the biology. The bigger challenges are often accepting the emotions of shame or fear or emptiness that we also have to heal. Accepting ourselves.
So it's sort of like micromanaging that particular.
Yeah, don't go ballistic over it. It's not going to yield you. The single progesterone challenge is not going to be the key that if you don't have it, you're going to croak. Doesn't work like that. There's a million redundant systems in the body. So if it comes down to you do due diligence and you really come to the end of your progesterone rope and you go, I can't figure out progesterone, let yourself feel the fear that something's wrong with you and something's missing in you. Because there is. But it's a concept. The concept that there's something wrong in me and there's something missing in me really helps support that part of ourselves that is exposing shame. There's something wrong with me. So the remedy is not forcing progesterone down your throat. It's acquiring the information and tools to deal with this niggle naggle called there's something wrong with me and I'll never make it because this is the fatal flaw.
Well, I mean, you see, you use this terminology that I like. It's always at the vanguard of, you know? And so I guess what you're saying is don't let the lack of progesterone be at the vanguard of that stress response so that you're just micromanaging and honing into, I can't take 10 milligrams of progesterone, but I can only take 5 and now I'm done for?
I'm doomed, yeah. No, the elephant in that room is not 5 or 10 milligrams or zero progesterone. The elephant in that room is this internal concept called I'm doomed, I'm screwed. There's something fundamentally wrong with me. It's called shame. I was living in Colorado and I had a friend and we were living north of Aspen, and I had a friend in the middle of winter wanted to invite me to attend a lecture in Denver. Well, that was a hike. You have to go through this mountain pass that when there's snow, man, you got to put chains on to make it through an interstate mountain pass just west of Denver. It's quite the journey, but he wanted to go. He wanted me to go with him, and I didn't ask any questions. I said, sure, we'll go on the adventure. And we show up at this humongous Denver auditorium that seated at least 5,000 people. And we arrive early and we're getting in our seats. And I'm looking around, and this auditorium is totally filling up. And I'm thinking, wow, people paid good money to see who's ever about to perform. I had heard the name, but I didn't know anything about the person. I just trusted my friend. And it was a psychologist named John Bradshaw who is lecturing on his latest book called Healing the Shame That Binds You. Shame. 5,000 people showed up in 1980 something to see John Bradshaw just put out a book called Healing the Shame That Binds You. And as he got into that lecture and talking about shame, what it was and what to do about it, I went, no wonder 5,000 people showed up, because this is a very relevant topic. So it's a long way around saying, if you think there's something specific that you're doomed, the elephant in the room is not that specific thing, because there's so much wonderful redundant biology. There's so many workarounds. But there is an elephant in that room, and it's called, this is exposing the part of me that really feels there's something wrong with me. Well, I discovered that when I was in my late 30s. I kept drilling down into what the uncomfort was about, and I ran into my own feeling like there's something wrong with me. That's not a useful concept to be carrying around in one's heart and mind. And it's like epidemic in the human race. So the great news is, if you acquire some skills to heal shame and you do it, that's going to take you many steps closer to a successful, loving, fun, happy, peaceful life.
And then that change that happens at whatever age might become a bit simpler.
Yes, and then the paradox is, and I'm not guaranteeing this, that should you heal the shame, or what's really at the bottom line of what's going on there for you, lo and behold, sometimes all of a sudden progesterone becomes easy. Because our body doesn't like it, doesn't like us to find the wrong answer. But if we find the right answer, it removes the hurdle very often, or it doesn't even matter. It doesn't even matter if you solve the progesterone issue. That's not deep enough.
Right, better yet, right?
Progesterone is not deep enough. I love progesterone. I'm here today because of progesterone, because I prescribed it serendipitously to a patient 28, 29 years ago. And she was going crazy, and it totally got her back to herself. I love progesterone, but there's so much more to human health and healing, and it's not dependent upon progesterone or any thing.
Many other things, right?
Yeah. You want to get to the bottom of it, and we're multidimensional, so anything that exists on any level of our being simultaneously exists on every level of our being. So we're physical, we're mental, we're emotional, we have a heart, we have a soul, we have cells, we have nuclei, we have genes. We're multidimensional. Anything that's taking place on any level is simultaneously taking place on every level. And if something's taking place that you don't like, the real issue becomes, where's the leverage? How can I address this? Well, taking some extra vitamin C can be a good thing, but it's not going to be the deepest answer. You're going to find the deepest answer on the level of your emotions, in your heart, in your soul, in your mind, in your connection or disconnection from yourself and the divine. So it's not going to be a matter of progesterone. It's going to go much deeper than that. I prescribe progesterone every single day. I write 1 or 2 or 5 prescriptions for progesterone. But that's not the ultimate answer. So here we go. I've gone off the deep end again, Carolyn Shapiro.
The supplements, they threw you off the deep end. I'm just kidding. I think that it's very eloquently put, and I really appreciate that you go there, and I know other people do too, because I hear all about it. Believe believe me. A few minutes left. Let me see if I can get you to answer this one. Having said everything that you did say, how does one keep, being on the topic of progesterone, how does one keep progesterone from metabolizing into cortisol? I could never get my progesterone up with cream, so I went to Troche's, but seems like, however, I'm having the same problem with the Troche's as I was with the cream, and I can't get my progesterone up.
Well, this is the kind of situation where we would address this situation professionally, like we do all situations. We gather a whole bunch of information. It takes us an hour to review. First, to gather, people fill out a questionnaire online or on their phone now on an app. And then we go line item by line item by line item. We learn so much about an individual. And always what happens, without exception, is we get clues to the next step to take. Because there's always a solution. Healing is possible. This is the general thing I'm giving you. And you just gotta know what you're doing, and you gotta investigate and spend the time, and you'll learn what the issues are and where to at least start the process of unraveling what the heck's going on there. Now, there were several things that were stated in that question that I want to challenge. One is that your progesterone is converting to cortisol, and you give yourself progesterone and it's converting to cortisol. Well, anyone who is familiar with the biochemical roadmaps can see that there's many steps to produce any chemical in our body. And for example, progesterone actually derives from cholesterol. You don't want to get your cholesterol too low. You're not going to be able to produce steroid hormones, progesterone, estrogen, testosterone, because they're all derived from cholesterol. I've often thought, well, why don't we just give men and women butter for menopause? Because that's what they're going to make the hormones out of, but they can't make the hormones anymore, so that's ridiculous, but it's fun to think about. And you want to watch out for those cholesterol lowering medications, because sometimes they can take that cholesterol too low. But there's many steps in a biochemical process, and anyone who's super familiar with the details of the cortisol train of biochemistry, they see that progesterone is there somewhere along the way. But just because this person is making a statement that how can they prevent their progesterone from converting too much to cortisol, I want the evidence that that's actually taking place. And I want a 24-hour urine to see. And I want sequential testing to see, oh, you increase your progesterone and you get more cortisol? I've never seen that. You never say never in medicine. That's, of course, possible. Then you would ask the question, why in the heck is that happening? Something has ramped up the stress pathway. You producing excessive cortisol, it ain't coming out of the blue, and it ain't a matter of biochemistry. Your body has got an increased need for cortisol, and that means you don't have the information and tools to deal with the stress of your life so successfully that you don't trigger the fight or flight response all the time. Because talk about vanguard, cortisol is at the vanguard of the fight or flight response. That and adrenaline, man, they are the leaders of the pack. So if you're getting, quote, something I would like to see the evidence of, excessive conversion of your progesterone to cortisol, the elephant in the room is not the biochemistry. There's a reason why that would be occurring, although I've never seen it, so I can't, but everything's possible in medicine. Let's say it is happening. You want to ask the question, why am I producing so much cortisol? Obviously, I'm freaking out. So you need an anti-freaking out mentoring, support, information, tools, so you're not freaking out. You don't want to over-trigger the biology of the fight or flight response, even under the worst of circumstances.
So may I ask you this? I know you're going to say what you're going to say in about 1 second, but can that happen to men too? The cortisol thing?
Well, how about we save it for next time? It,
Okay.
it's a wonderful question, but it always takes us back down to the basics. Someone's got something going on that they don't like, and it's troublesome, and it's interfering with their life. What do? You go to someone who likes to solve issues of healing, and you go shopping. You may have to go to more than one person of more than one discipline, more than one approach. But healing is possible, and there's all kinds of professionals who've devoted their adult lives to learning about solving healing issues. There's so many different wonderful approaches: acupuncture, Ayurveda. The list is so long. You go find these folks: psychologists, social workers, counselors, health coaches. There's an army out there, and if you got a significant biological problem, you got to go shopping. I did. I spent a lot of time. They're always good people. That was the hallmark. These professions tend to attract really good human beings. They're trying to solve the human issues, but they may not be able to help you, so you move on, or they help you for a while, so you move on to the next one, and the next one, and the next one, and the result is you heal, because healing is possible. And with that, Carolyn Shapiro, I'm going to say hasta la Tuesday.
Hasta la Tuesday.
Yeah.
David Rosensweet, MD. Is today Tuesday?
No, hasta la Tuesday. Until next Tuesday.
I was going to say, I need to go see one of those people to put your brains back together because I can never remember. Thank you so much, always, for bringing us back to really what the important things are, I think. And many do. As I said, I do hear about it. So, wishing you a fabulous weekend. Thank you so much for always being here. It's always so pleasant. And thank you, ladies, always for being here. That is always so pleasant, too. Wish everybody a great weekend. Happy, happy, and laugh, enjoy, have fun. And if you need to cry, do that, too. You know?